Of July 22nd, 2012, I got married to my beautiful wife, Eva. A week later, we found out that my mom had been diagnosed with stage 4 HPV tonsil cancer. This cancer had been something she'd been fighting for the past year. In fact, it had grown in size due to the medication that her previous doctor had administered for what that doctor thought she was ill with. So that the medicine she prescribed ended up causing the tumor in her neck, which had attached to her lymph nodes, to swell. This gave my mom a hard time to swallow and to chew. This really stressed her out beyond no point. It had the entire family worried. So really quickly, me and my sister decided to call around the country to see if we could get her an appointment with either a hospital or a cancer treatment center that could help take care of her. Eventually, what ended up happening is my mom was able to get into Mayo Clinic thanks to my sister. She ended up being there for about 4 months, and while she was there, she got chemo treatments, a full chemo treatment to deal with the stage 4 cancer. By the time she was done with it, she was in remission, and it's been 1.5 years now, and she's doing much better. There were some tolls on her body. She has been worn down quite a bit, and at age 66, she's in weaker health than she would have been normally without cancer, but we're all very thankful to have her free of this illness. So I want to first examine what cancer is. Cancer is abnormal cells that multiply without control to invade other parts of the body. Okay? That means that the cells are multiplying, attacking cells that the body believes is cancerous. Now, there will approximately be 1.5 million Americans who are diagnosed with cancer this year alone. On top of that, the deaths are outrageous. 600,000 deaths are expected to be within the next year. That means 1 in 4 people. If you have 4 friends, 1 of you is going to die of cancer. It's an incredible statistic. Cancer is brought on by humans getting older. It comes down from the breakdown of the human body. A cancer is a result of living longer, such as diabetes or other diseases that Americans who are living longer nowadays are facing. So, let's now examine different types of cancer. There are over 100 different types of cancer. According to this website I found, the Live Science website, these are the top 5 killer cancers out there. Number 1, lung cancer, caused by smoking and the use of tobacco. According to the National Cancer Institute, lung cancer strikes between the age of 55 and 65 if you've been smoking your entire life. Number 2, colon cancer, caused by benign polyps in the intestines, down by the anus. Number 3, breast cancer, the second most common cancer in women, forms in the ducts where milk is transferred to the nipple. The National Cancer Institute estimates that there were nearly 2,000 cases in men between 2003 and 2005. So men can get breast cancer as well. Number 4 is pancreatic cancer. Now this is the hardest cancer to detect because it spreads fast and it's very silent. It will claim approximately 40,000 lives, and it attacks the pancreas, which help aid in your digestion and your metabolism regulation. So if the cancer is attacking your pancreas, your body's obviously not able to fight back during the cancer. You have no metabolism, so if you get sick, you could get even worse. And then the 5th type of cancer is prostate cancer, second leading cause of death in men, seeing about 32,000 deaths a year. But despite all that, there are treatments for cancer. We're going to focus on some of those now. Some of these advancements range from vaccinations to chemo to surgery. And so let's first talk about chemotherapy. It's a standard practice when dealing with cancer to suggest chemo to the patient first, unless it's a very emergency situation where surgery is required. Chemotherapy is about 80% effective. My mom got they used the treatment of chemotherapy on her, and it was quite intense for her. Every time they went to give her the treatment, it wore and tore down her body. She started losing hair in the back of her neck. She was throwing up every day. She couldn't eat. She was so weak. But, I mean, she was able to, the chemo did help. Although she did say that she would never use, if the cancer came back, she would not choose to do chemotherapy. It's very hard on the body and the metabolism. And then also there are vaccines. 3 cancer vaccines have been approved by the FDA. Another 2 have been approved for use for HPV, which is what my mother had. I have gotten the HPV vaccination after my mother was diagnosed. I got really worried, and so it's something that me and my wife and my children are, we want to get done for them as well, because more and more people are having HPV cancer. So now, as morbid as this gets, and as dangerous as cancer is, there is prevention possibilities out there. So let's pay attention to these points specifically. These are simple things that you can do every day to reduce your chances of cancer. First of all, don't use tobacco. It affects your loved ones. The American Cancer Society estimates that 23,000 to 73,000 people will die from secondhand smoke in this year, or a year alone. So that means you go outside, have a cigarette, and you come back in, your family is breathing in those toxins. Maintain a healthy body weight. Obesity contributes 14 to 20% of all cancer deaths. Very easy. 30 minutes of exercise a day. It's a good habit to have, and it will increase your chances of living longer. Processed food is bad for you. Fruits and vegetables, stay away from red meat. These are very easy things. And reduce your alcohol intake. Even a regular few drinks a week have shown to increase breast cancer chances in women. So, with all that said, cancer is extremely dangerous, but there are things that you can do. As far as cancer in my family, my mom is still fighting back against it. Even though she's cured, she has to go back to the Mayo Clinic every 3 months. After a 2-year period, it'll be every 4 months. Until then, she still has to make that commute. She still has to change her life. She still has to take all these medications and so on. Cancer changes your life forever. And thank you.